We will go ahead and get started. Dr. Fred Beauvais will be here, but a little bit late. This is a very busy several days, and so he will be running slightly behind. I am Thad Waits. I'm an interventional cardiologist from Hattiesburg, Mississippi, formerly at Oxnard in New Orleans, and also living in Hattiesburg, not too far from Katrina, so I have some contact with some of the subject today. Today we have our second Consumer Interest Press Conference that features interesting, non-late-breaking studies about how crisis impacts heart health in affected communities presented here at ACC 13. We have allotted 1 hour for this press conference. Presenters will have about 5 minutes each to talk about their research highlights, and we will provide some comments to each of the studies. We have then allotted about 20 minutes for question and answer. My script then says we also have Thad Waits, but that's me, so I will just say that both Dr. Beauvais and I will be doing this. I am immediate past chair of the ACC Board of Governors. In addition, later, Dr. Patrick O'Gara, Vice President of the American College of Cardiology, Director of Clinical Cardiology at Brigham and Women's Hospital, and Professor of Medicine at Harvard Medical School will be available in the newsroom today, and that's between 3:30 and 4. To provide additional comment on these studies. So here's Dr. Beauvais, and I will just immediately turn it over to him. So we're down to here. Good.
Well, I thank you very much. I was just finishing up another commitment here. So our first speaker is Dr. Emmanouil Makaris, who is an associate professor of medicine and director of interventional cardiology at the Heart and Vascular Institute at Tulane University, and also the chief of cardiology at the Southeastern Louisiana VA healthcare system. His topic is increased incidence of acute coronary syndromes following Hurricane Katrina, and I guess the protocol will be a 5-minute presentation, and then we'll open it up for questions. So. Go ahead and let's look at your data. Thank you very much. Our next speaker is Dr. Emmanouil Makaris, who is a consultant cardiologist at the General Hospital in Kalamata, Greece, who is going to present a study called Socioeconomic Crisis and Incidence of Acute Myocardial Infarction in Messenia, Greece. So, thank you.
In the last 5 years, Greece is facing the worst socioeconomic crisis since the end of the Second World War. During these 5 years, almost a quarter of the national gross domestic product has been lost, and the unemployment rate has been escalated at unprecedented rates, from 8% in 2008 to almost 30% in 2013. The purpose of our study is to investigate the impact of this crisis on incidence of acute myocardial infarction in the prefecture of Messenia. The total population of this region is 170,000 people, and they are the only hospital which hospitalizes cases with myocardial infarction is the General Hospital of Kalamata, where our study refers to. We retrospectively analyzed the medical records of all the patients admitted to the cardiology department of the Kalamata General Hospital for incident cases of myocardial infarction during the last 10 years. This period was divided in these two equal segments. The first part, referred as the pre-crisis periods, from January 2003 to December 2007. The second period is from 2008 until 2012. 2008 was the first year that a negative rate in GDP was noticed, a trend that still stays on until now. Comparing the incidence of acute myocardial infarction between the two periods, we found the following results. During the crisis, the incidence of myocardial infarction was increased by 44%. During the crisis, the incidence of acute myocardial infarction was 57% increased in women, whereas in men was 40%. Greek women have a higher unemployment rate than men, almost 40% versus 26%. They are responsible for child care, and they also work outside the home, a formula for stress and possibly for the increased myocardial infarction rate. In people over 45-year-old, the increase was 41%, whereas in people under 45, the increase was 30%. Factors that might contribute to the higher incidence among older patients include limited job opportunities for unemployed middle-aged men and their much greater prevalence of atherosclerosis, a major risk factor. More susceptible to myocardial infarction were found to be people living in urban areas than those from rural areas. From this observation, we can speculate what is going on in Athens. The capital has almost 3 million people and is an urban industrialized area that may be more affected by the financial crisis. Uninsured people were also more affected comparing to those insured. Unemployment, as we know, is a stressful event, and stress is connected with heart diseases. Fatal myocardial infarction were also increased. Yesterday, in a poster session, many colleagues from all over the world kept asking me to explain this dramatic increase in incidence of myocardial infarction during the crisis period. During the crisis, many stressful events happened. All these events affect the society in general and the particular person. I can recall some characteristic examples of patients just to show what must have happened. A patient having done PCI just 3 months ago didn't afford to pay the medication clopidogrel, and the result was another myocardial infarction. Another patient has lost his job and had no means to take care of his family, and the result was another myocardial infarction. Suicides have been on the rise since the crisis began, but still in the lowest position in Europe. People are losing their homes because they are unable to keep them any longer due to the overwhelming increase in taxes. People are searching through trash bins in the hope they'll find food. Everyday people who until just recently had a job and were able to support their families. Children are fainting in schools because of starvation. All of these problems are magnified in large cities. People are thinking twice about having children, or at least more than one, because they're worried they won't be able to afford them. High school graduates who have written well in college entrance examinations won't, however, be able to attend college because their parents can't afford to rent them an apartment. And of course, the saddest incident of all, some of college students made a homemade indoor barbecue to cook on, left it burning all night so they can stay warm, and died from carbon monoxide suffocation. No one can afford heating oil anymore. People are using fireplaces, wood stoves, etc., to heat their homes, thereby causing yet another problem by polluting the air and making it dangerous to even go outside. This crisis has affected every single aspect of the lives of Greece, young and old. Our findings suggest that the prolonged financial crisis may have led to a higher incidence of acute myocardial infarction in the population of Messina. There is an urgent need to conduct a nationally representative study to evaluate the possible impact of the financial crisis on the incidence of acute myocardial infarction for the entire Greek population. This becomes especially important as funds allocated to health services are reduced every year due to the financial crisis. With these findings, we aim to educate health professionals and policy makers about the serious impact the financial crisis is having on heart health, at a time when austerity measures are slashing medical staff, supplies and services, and ultimately to increase resources required to cope with escalating need by changing the country's health policy.
Thank you.
Thank you.
It's a quite compelling presentation, I must say.
Thank you so much.
And I think we all see ourselves as potential victims of the same thing if we're not careful about our finances. But the consequences you describe are devastating. I mean, not only do we have the stress, but we have lack of medications, we have lack of heating, we have people burning wood in their houses and getting carbon monoxide intoxication. It's amazing the consequences of this kind of event. This was a national event, not a local event like Katrina, for example. So you expect that, I guess, if you looked at the whole country, you would see similar effects around the country, perhaps in some small areas of well-to-do people. But are you interested? I mean, will you be able to do the national study from your data?
Yes, we aim to do so, to gather all the data from all the hospitals around Greece, just to find if there is increased incidence all around Greece.
Dr. Waite, comments?
No questions, just my deep sympathy. That's a dramatic statement you just made.
Thank you.
Questions from the audience? Okay, thank you. So our final presentation today is the presentation